New York Governor Kathy Hochul held a Monday press briefing on her state's public health. The New York governor announced that she was pivoting from calling it, quote, a COVID briefing to just a virus briefing because we have other viruses to talk about. Those viruses included monkeypox and polio. Hochul first talked about COVID, urging New Yorkers to get vaccinated if they haven't, and directly shared a message to parents as the new school year approaches. The New York Democrat called kids learning in a classroom, quote, essential, and vowed, quote, the days of sending an entire classroom home because one person was symptomatic or tests positive, those days are over.
The all-star dream team that I'm blessed to work with every single day, and that starts with Catherine Garcia, our head of state operations, and Dr. Mary Bassett, the Commissioner of Health, and today we're here to talk about New Yorkers' health. And I think I'm going to morph from calling this a COVID briefing to just a virus briefing because we have other viruses to talk about. But I also just want to make sure that we're focusing on what's important. New Yorkers continue to be concerned, especially as we approach the final days, parents, final days before kids get back to school. So we want to give more information. Let's first of all talk to the latest numbers, and then we'll focus on our back to school strategy. You can see our 7-day average, about 22 cases per 100,000. A little bit down from last week, which is about 22 cases per 100,000. And a month ago, we were at 35, so that is a good trend. Just to give you perspective, last January, Omicron peak, we had over 381 cases per 100,000. So being around 22, 23 is progress, but it's been steady. You can see that it's been very steady over the last few months. Regionally, you can see again where we're coming from, not a big variance for the first time in a while, although we're seeing some higher numbers on Long Island. Hospitalizations continue to be low, just relatively stable. Last week we had 2,300 people hospitalized. That's still a lot of New Yorkers, 2,365 people in the hospital from contracting COVID, but that's down a little bit from the week before. And our peak, we're down still again quite a bit. Nothing unique about the regional variances right now, which is good. Vaccination, 40 million doses, extraordinary, but there's more to be done. So this is a time to just have that wake-up call, say, what have you been waiting for? Everybody knows been vaccinated, so to those who have not, we encourage you, especially get your children vaccinated as we're heading into school. Our numbers are better than most states, but we never rest on our laurels here. But today I'm here to talk directly to parents. And yes, schools are ready for their children to burst through those doors with eager anticipation of another school year. And what a difference a year makes from where we were announcing our back to school strategy. I was brand new on the job, but I also knew we had kids going back to school within a matter of days. And so we had to ramp up our efforts immediately. And we had a lot of rules last year. We had social distancing, we had quarantine after exposure, we had test to stay. So there's a lot of rules that parents and teachers and administrators had to be familiar with. And it was confusing, very frustrating, stressful. The unknown, fear of the unknown, because this was the first fall when our expectation was that everybody went back to school. And so because parents, I'm a parent, now a grandparent, we know our primary responsibility is to protect the health of our children. I want parents to know as governor, I share in that responsibility. It is my responsibility to do everything I can to protect your families as well. So I'm grateful that this year we have a different scenario, different landscape, so to speak, and we're expected to be a much, much easier year for parents and for schools. You heard last week that the CDC issued guidance. We've been analyzing the guidance, and they relaxed their guidance with respect to K through 12 schools and early childhood education programs. Here in New York, we want to be fully aligned with the CDC, but we wanted to take a little bit of time to process what that actually meant before we release data. And later today, the Department of Health and the State Education Department will be releasing a letter to schools to reinforce our support for the CDC guidance and to have frequently asked questions, so they will be apprised of everything we expect for this fall. So that information is coming out later today. But the big news is no more quarantining, no more test to stay, and in the days of sending an entire classroom home because one person was symptomatic or test positive, those days are over. we've been through that experiment. No days, no longer going to be sending kids home, keeping them away from that essential experience of being together in a classroom, because we are now still dealing with the fallout of those decisions made when we had less information and there was concern in classrooms. But we now have 2 years of experience to know that children are safe in classrooms, and when they're not in a classroom and the learning stops, the traditional learning stops, it can be devastating for the well-being of those children. We're seeing it in the mental health challenges we're facing now, suicide rates, depression, real mental health issues that were not there before for many of these children. And that is deeply troubling to us. So we're aligning ourselves with the CDC. We're getting this information out to parents and to schools, and making sure that our children are where they need to be this fall, because we know there's no replacement for in-classroom learning. And we're going to make sure that this year is a very different year. So let's go into some of the guidance so everyone's clear on this. As of last Thursday, August 11th, the CDC is no longer recommending quarantining due to exposure. So let's lay this out. If a student or teacher is exposed, has a close contact who's exposed, and they don't have symptoms, they no longer have to go home. They will stay in school. And the CDC does recommend the wearing of a mask for about 10 days if someone's been exposed. So no more test to stay. What that means, if a classmate tests positive for COVID and your child doesn't have symptoms, your child can stay in school as long as they would wear a mask under those circumstances. That's what we're recommending. So that's good news. If a child does get sick, we still want to make sure that there's a smart approach. And of course, if there's symptoms, you always want to be tested. And students should stay home. Recommend that they stay home for about 5 days and wear a mask as well. And if they have no symptoms after 5 days and test negative, they should go back to school. Let's get them back into school as soon as possible. So that's what they're recommending. That's what we're recommending. And we're no longer recommending, and CDC and Department of Health are aligned with this, no longer recommending the screening testing, which is randomly testing people who have no symptoms. That was important a year ago, before that. But in certain circumstances, schools may want to opt for doing screening testing in high-risk activities, for example. Let's think about a choir where children are close together, a wrestling team. So we'll leave that up to individual schools to make that determination, but it is no longer recommended from the CDC or the Department of Health that there be this random screening either. So now that we've covered that, that is a change. That is how we'll be approaching this school year. We are going to be also talking about our overall fall action plan. And we've been able to identify patterns. And I spoke about this when we gathered in July, when I said we're putting together our fall plan, even though it was a beautiful day in July. We're getting closer to that time. So what we've seen in the past is a trend that we cannot lose sight of. The number of cases per 100,000 really went up dramatically in the fall after seeing major declines and stabilization over the summer months. So will that happen again? We don't know. But our policy has always been, for the last year straight, has been to be prepared for the worst. So that is why we're going to continue looking at those patterns and make sure that, while these numbers tend to spike in the fall, the weather gets colder, people congregate more. And this fall, we're really hoping that the doors are open not just to schools, but to offices after Labor Day. We get more people back. I walk the streets of Midtown literally every day, almost 5 days a week. You don't see me, but I see all of you. And I know, there's a lot of tourists. Restaurants are crowded. People are coming back, enjoying our social life. And we'd love to see everybody going back in their offices, or at least on a hybrid situation. So we're encouraging the employers who are encouraging that as well. So what we're going to see also then, more people in congregate settings working together in offices. So we're going to be vigilant. We're going to remain prepared. And of course, the best way to do it, sound like a broken record, but that's okay. The music hasn't changed. Get a vaccination. Get a vaccination. And make sure your kids are vaccinated. So again, if you waited to see how it plays out with your friends, you want to make sure everybody's doing well. We've now had a long enough history to realize that these vaccines are safe. So we launched our Vax to School campaign last week again. It's aimed at increasing COVID vaccination rates among school-age New Yorkers, and again, breaking down barriers to vaccine access. This is something we track and monitor, make sure that there are no disparities, especially in communities of color, for access to vaccines. So we're partnering again this year with community organizations, pop-up vaccination clinics, encouraging families to take advantage of this, and there's the website to check out, the closest site to all of you. So our fall plan that we mentioned before, focus on the schools. We're going to get the test kits out there, though. We have been very good at this. Last November, when Omicron had literally just been identified as a variant, our state sprung into action. And I thank Catherine Garcia and her team for scouring the earth when there was a short supply of test kits. At a time, it was November, December, and we knew we had to make sure that kids got back to school last January. This was a great sense of stress on families. Are the kids going to be able to go back there safely? And we knew if we had a testing strategy where we can get tests in the hands of every single school, every single student, that we could be successful in getting the kids where they belong. So the strategy again this year is making sure that we have ample supply. We've done a masterful job in terms of amassing more than other states, getting ahead of the game, and to the extent that last winter, other states were asking us. Federal government was talking to us about our supply. We have used it. We've gotten it out. We were able to get kids back to school. This year, we're going to be distributing once again to schools, one test kit per child at the start. But schools can request additional kits. We're in a good position to meet that demand, and that's where we have over 14 million kits in inventory, and we procured another 6 million. So that is a good strategy. Again, best strategy is get vaccinated. Number two is make sure that we have the test kits available. Also, we want to make sure every New Yorker has access to medical assistance and treatment should they contract the virus. Therapeutics are critical. I had to take advantage of them a few months ago, and they work very well, so we make sure that we have access to that so people can call and find out where they can get them, and we'll make sure they're available. So right now, 40% of our pharmacies receive from the federal government their supply of therapeutics, as well as our 44 sites. But there has to be equitable access to this or the system doesn't work. So we have a hotline, as I mentioned, phone number to call. And since we launched the hotline, we've had over 1,700 calls, over 1,100 visits for treatment as a result of people being able to make that phone call, find out where the treatments are available, and make sure that people take advantage of that as well. Threw a lot of information at you. It's important. Parents, it's a very different year. It's a very different year, especially if your kids are vaccinated. We do have test kits. We're trying to just draw down the anxiety associated with sending your children off to school this year, and it is a much better year. I am concerned about the trend, but if we can just regroup in about a month, we'll be able to assess the numbers and see whether or not those trends of the past are no longer, which would be a good dynamic that we came through the advent of school and people going indoors more safely. So again, we took a lot of precautions with our fall action plan. We're continuing to roll this out, and look forward to the day when I'll be talking about our winter plan, because maybe we won't need a winter plan. Maybe we'll continue to be in a far better place. But I want to talk to Dr. Bassett now,